Can chlamydia lead to tubal factor infertility? Have you ever wondered about the link between chlamydia and infertility? Chlamydia trachomatis is a common sexually transmitted bacterial infection that can significantly impact female fertility. One of the serious consequences of untreated chlamydia is tubal factor infertility. This condition occurs when the fallopian tubes, which are crucial for conception, become damaged or blocked. Let's break down how chlamydia can lead to this issue. Initially, a chlamydia infection may not show any symptoms or might cause mild symptoms. This can lead to a delay in diagnosis and treatment. If left untreated, the bacteria can move from the cervix to the upper reproductive tract, leading to pelvic inflammatory disease, often referred to as PID. PID is an inflammatory condition affecting the uterus, fallopian tubes, and surrounding pelvic structures. The inflammation from PID can cause scarring and blockage in the fallopian tubes. This damage can hinder the tube's ability to function properly, which includes transporting eggs and embryos. When this happens, it can lead to infertility or increase the risk of ectopic pregnancy, where the embryo implants outside the uterus. Additionally, the immune response to chlamydia can create further tissue damage. The body produces antibodies and inflammatory substances that can lead to chronic inflammation. This ongoing inflammation can make the fallopian tubes less receptive to fertilization and implantation. To understand if tubal damage has occurred, healthcare providers may use serological tests to detect antibodies against chlamydia. However, these tests cannot determine the extent of the damage. Imaging studies or a procedure called laparoscopy may be necessary for a more definitive diagnosis. Chlamydia is not the only condition that can affect fertility. Endometriosis, which involves endometrial-like tissue growing outside the uterus, can also cause pelvic adhesions and tubal dysfunction. Both conditions can coexist and contribute to infertility, but they have different mechanisms. Chronic pelvic inflammation from infections like chlamydia can sometimes worsen endometriosis-related damage. Preventing chlamydia infections is crucial. Early detection and antibiotic treatment can help prevent the progression to PID and subsequent tubal damage. Safe sexual practices and regular screenings are important preventive measures. If tubal damage has already occurred, fertility treatments such as in vitro fertilization may be necessary, as surgical repair of the tubes is often not very successful. In conclusion, chlamydia infection can indeed lead to tubal factor infertility by causing pelvic inflammatory disease that damages the fallopian tubes. Women with a history of chlamydia or PID should be evaluated for possible tubal damage if they face difficulties in conceiving. Timely treatment and appropriate fertility interventions are essential for those affected. Always consult healthcare professionals for personalized advice and management options.